This is Jerry Hesch presenting. I'm with the Hesch Institute in Las Vegas, Nevada, actually Henderson, nearby Las Vegas. In this case is called ilium hypermobility, or hypermobile, sorry, is hypermobility syndrome in general throughout his body, which one would never guess looking at this very athletic body. He was a gymnast, great at many sports, but his joints are very, very lax, and his ilium is lax. And yesterday we treated a downslip of the left ilium, and the day before that we treated a sacral torsion. And I told him that I believed that because a downslip of the ilium is one of the more unstable, positionally unstable patterns of the sacroiliac joint, that restoring that oftentimes makes people very stable. And he was, you know, disagreeing with me, which is fine. And I said, well, let's test it. Let's find out, okay? And he's right. He is correct. And what's interesting is that he is wearing an SI belt now. We'll take it off in a short while. But I did all of my spring tests, and I'm showing him, look, this is normal. I can take up the slack, I can spring it, and it recoils with integrity on both sides. And so we're doing that throughout the body. And then I come to a spring test that I use. I don't know of anyone else that uses it. I use several more. But I spring on the ischium, on the flat part of the ischia, which is right above the, it's in the lower third of the pelvis. If you divide the pelvis into upper, middle, and lower third, the flat part of the ischium is going to be on the lower part of the buttock. So you just put your heel of your hand in there, and you take up this slack to an end point, and then you spring. And this has a lot of movement. When I do the same test over here on the right side, I take up the slack much quicker, but it's normal. This is normal. And then when I spring it, there is a little bit of give that shows that the force does go through the pelvic joints and down the rest, up the body and down the body. Okay, you can see a little movement in that heel. On this side, it is distinctly greater. And that really surprised me. Okay, and there's that spring, and it's a lot of movement. Okay, we could do an experiment like wedging both sides. Let's do that. Let's prop this under each side on the front of the pelvis, just to make sure that we're not dealing with an artifact. So he's laying on pretty dense foam there. So on the strong side, there's ischial tuberosity right there. Okay, so again, I can take up the slack, and you can see the leg movement when I take up the slack through the structure, and I can get a little bit of spring, a little bit of recoil. If I did the test properly, as I let go, there'll be a final recoil. Okay, so we come to this side, take up the slack, spring. It's a lot of movement. It's not artifact. Okay, what's interesting is that palpating the sacrotuberous ligament and the sacrospinous ligament, it was lax yesterday from the downslip. It was a positional laxity, but today it tests normal. Because now the position of the ilium relative to the sacrum is normative, and this ligament tests strong. So it could be the shape of the joint is different side to side, or it could be damage in other ligamentous structures. I'm going to check the long dorsal SI, but we checked that yesterday, and that felt pretty firm. You know, felt fairly symmetrical in terms of extension. So it could be the short SI ligaments that we don't really have access to. They're deep to the multifidi and erector spinae tendon. So those are hard to test, and the interosseous ligament is very hard to test. Now, what's interesting is that the orthopedic research tells us that the best place to wear an SI belt is actually over the trochanters. So would you go ahead and put that down on the trochanters? Yes. And I think you'll be very surprised to see that it in fact is much better, and his SI is much more stable when he puts it on the trochanters. And so the main point of this brief film is that springing the ischia is a relevant passive accessory motion spring test of the lumbopelvic region, SI region. And the other concept is that wearing the SI belt lower over the trochanters.
It's a small belt. That's the problem.
Yeah, we need to give him a slightly longer belt. And you're applying approximately the same tension on that belt, yes?
Mm-hmm.
When you put it on the trochanters as you did above, yep.
Correct.
Good, good. So we'll wrap this up very soon.
You definitely need a larger belt.
Okay. Good, thank you. Let's see if it stays, please stay. All right. So now that he applies the belt lower, some really good research shows that you get 40% more compression inside the SI joint and joints and inside the symphysis pubis joint when applied here. And so lower third is right here. Take up the slack and you'll notice it's already more solid. Okay? And now when I spring it, it's just a little bit of give. So it definitely is much better worn over his trochanters. He definitely is more stable. Lastly, could you walk around and just give us some feedback? And then we'll be finished.
Sure, just pop off.
Any thoughts?
I do think it feels more, confident. I feel more confident with the belt there. I think I do.
Okay. What does it mean, more confident?
More confident meaning that there is support in a way that there hasn't felt quite the support the way I was wearing the belt.
Perfect.
And I think I was taught to wear the belt just slightly over the trochanters, but
you mean above?
Above, just a little bit above. And then of course it slides up as time goes on.
That's right. That's right. Good. So just to summarize, wearing the belt at the trochanters is tolerated well, makes him feel much more stable. When I do the spring test, you can see that it definitely constrains the SI motion. And the last piece is springing the ischia, going from posterior to anterior with a client prone, is a valuable spring test. And I'm Jerry Hesch, and I'm with the Hesch Institute near Las Vegas, Nevada. Thank you very much.